Runway 8 kilo, you're clear for takeoff.
Hello everybody, and I'm here today talking to Dr. Gail Richardson, and we're going to be discussing chronic illnesses. And she is a nurse practitioner. She is also a certified diabetic educator. Dr. Richardson, could you please tell us what chronic illnesses is?
A chronic illness is something that lasts beyond 3 months. So it's diseases like high blood pressure, diabetes, cancer, and things like that, versus acute illnesses are things like a cold or respiratory illness that'll go away.
Oh, okay. Well, I didn't really understand that word, and I definitely know that we need to be educated about these things. So when you say chronic, does that mean that it's something that can never be healed? You can never be well from this ever again?
It doesn't mean that you can never be well. It's something that's going to be there, but you can control it very well. It's like having high blood pressure. It's a chronic illness. More than likely it doesn't go away, but you can manage it very well with diet, exercise, and sometimes medication.
Okay, so it can be managed.
Right.
Well, when we're talking about chronic care like diabetes, well, how do a person get diabetes? Do you eat it? Can you eat it on, or do it just comes? Is it hereditary? Or?
Well, diabetes is a group of diseases that are characterized by high blood sugars, either because the body can't make the insulin, or it can't use insulin, or a combination of both. So the blood sugars are higher than normal, and it can cause a lot of problems. It puts you at risk for serious complications such as eye disease, heart attacks and strokes, limb disease, amputations. People are more at risk for premature death, so they may die earlier. But there are risk factors for diabetes, things like older than age 45. So 45 and older is a risk factor. Having a parent, a sister or a brother with diabetes is a risk factor. Being overweight, having high blood pressure, high cholesterol, all these things put you at risk. Having pregnancy during having diabetes during pregnancy, we call it gestational diabetes. So if you were diabetic during pregnancy, or you have a baby larger than 9 pounds, that's also a risk factor. So these are the things that if you have these risks, we want you to be tested for diabetes. Certain family backgrounds, African American, Asian, Latino, American Indian, the people from the Pacific Islands. These are other risk factors. So if you have risk factors for diabetes, we want you to be tested for diabetes. And it's just a simple test. You just go to your doctor and say, you know, I'm concerned, I have some risk factors for diabetes, and I want to be tested.
Wow. Well, you said a lot then. Well, in my family, I've always heard that diabetes run in our family. My mother was diabetic. 3 of my sisters are diabetic, and recently I have been diagnosed with diabetes. But the doctor kept telling me, well, you're borderline, Mildred, so you can, your numbers are this, and then you can back it up, and if you start eating right and exercise and get that weight off, you'll probably never be on any medication. But he was telling me that I was pre-diabetic. But talking to you, you're saying that you don't even use that term anymore, because why?
Okay, that's a wonderful question. And I also have type 2 diabetes, and like you, I have a family history of diabetes, a lot of people in my family. But prediabetes is where the blood sugars are high. They're higher than normal, but it's not high enough yet to be diagnosed with diabetes.
Okay.
And people with prediabetes usually will develop type 2 diabetes within 10 years if they don't manage it. And they're at a greater risk for heart attacks and strokes. So they share some of the common characteristics with patients that have diabetes. So we don't use the word prediabetes anymore, because really, what does that mean? It's almost like saying, we don't use the word borderline diabetes anymore, because it's like saying you're borderline pregnant. Are you pregnant or are you not pregnant? So we now use the terms, you have diabetes, or you have prediabetes, or you don't have either.
Okay.
So we don't use borderline anymore, because some people actually had prediabetes and some people had diabetes, but they were not on any medicines and they was managing it by diet and exercise. So borderline diabetes was a confusing term for a lot of people.
Okay, well, thank you, Dr. Richardson. I heard you talking earlier about managing some tips that would help you during this season of the year. Give us a little information about tips and managing your diabetes.
Okay, so winter time is coming. It's fastly approaching. So we really, really want people to take care of themselves so they can prevent getting ill. Because when patients with diabetes get sick, a lot of times they develop complications and they get sick really quick. So one of the things that we encourage is, for this season, is that we really encourage people to get their immunizations. So we encourage yearly flu vaccines or influenza vaccines, and we encourage patients with diabetes to get a pneumonia vaccine. So most patients with diabetes should at least get one pneumonia vaccine during their lifetime, and some patients require an additional pneumonia vaccine. So we tell people to talk to their physician to find out how many pneumonia vaccines they should get.
Okay, well, I want to thank you for joining us today, and the information you have given us is what we need, especially people like myself who have been diagnosed. And again, I want to thank you, Dr. Richardson, for being with us today, and I hope you'll come and join us again.
Okay, thank you for having me.